So you've been researching medical billing and coding, and you decided that this is something that you may want to do. But you still have a few questions, like what are the career choices that I have once I receive my credential? Or maybe you're a seasoned medical biller or coder, and it's time to do something new. And you're probably wondering what different career paths you can take. Well, if that's you, then you're going to love this video because today we're going to talk about some of the most common career paths that medical coders and billers go through once they've been credentialed. What's up, everyone? My name is Kat, and I'm a certified professional medical coder, certified professional medical auditor, medical biller, and owner of Superior Medical Consulting, where we supply superior billing solutions for your private practice. You can visit our website at superiormedicalconsulting.com to schedule your free consultation. And this is Level Up Medical Coding. All right, so we got that out the way. Now, today I am so excited about this video because it's something that's kind of near and dear to me. Early on, when I decided that I wanted to pursue my medical coding career, I immediately thought about the opportunities that I would have in this field. I wanted to know, like, besides medical coding, is there anything else that I can do in this field? So it's brought me to AHIMA, and AHIMA has like a career map, and that career map can help you kind of loosely plan out your whole career path. Once I took a look at the map, I realized there was so many positions that I can like go for once I received my credential. It also helped me to take a look at other credentials that I may be interested in that may help, make me an expert in certain specialties along the way. And so this video is going to kind of be a generic overview of career paths, but I would encourage you to visit ahima.org and search up their career map and take a look at it, because in my opinion, it's such a valuable tool, especially if you are career minded and you want to progress. It's perfectly fine once you get your medical coding credential, your certificate, and you decide that you want to code for the rest of your career. But there are other people that want to do something else. You may want to do auditing, you may want to become an educator, you may want to be a director, you may want to be a manager, you may want to be in documentation. It's so many different opportunities out here. Once you get your credential, you just have to go exploring. But right now I'm going to talk about probably about 5 of the most common career paths that medical coders and billers take once they become credentialed. So let's just start off by giving an overview of what medical billing and medical coding is. Medical coding is the transcription of, documentation um, from providers into a alphanumeric code set that was created in part by CMS, AMA, CDC, and other entities that allows it to be a standardized way of reporting diagnoses and procedures that's done in the hospitals, clinic, etc. Coders codes are used for statistical purposes, and it also create a universal language so that all insurance companies, government entities, doctors, anyone in this field can recognize. So coders kind of just take the words that the providers, put in their notes, in their charts, translate it into these codes so that it could be prepared for the biller. The biller then takes those codes, basically put them on the claim form, um, and make sure that the claim is clean. Clean claims usually has to do with like payer policies, has to do with making sure that the diagnoses are pointing to the right procedures, making sure that the modifiers are correctly appended to the right procedure codes, and things of that nature. They would then submit those claims to the insurance company. Once the claim is processed and adjudicated, they will make sure that the payments get posted, make sure that the patient's monies is collected, whether it's copays, deductibles, co-insurances of those things. They also, rectify denials. They also follow up on, delayed claims, unpaid claims, things of that nature. So, medical coders basically translate medical encounters into code sets that's recognizable for statistical purposes and for reimbursement. The biller submits the claim for reimbursement purposes and makes sure that everything is closed up in the revenue cycle loop. Now that we know what medical billing and coding is, let's just get right into the nitty gritty. So, as you know, medical coding and billing plays a crucial role in the healthcare industry. It bridges the gap between the healthcare providers and the insurance companies. So, we ensure accurate payment is being given for the services that has been rendered. And I just want you to know that's not the only thing that you can do once you get your CPC or your CPB. There are numerous career paths within this field. So we're going to talk about, like I said, the most 5 common career paths that medical coders and billers can go down once they receive their credential. So obviously, the most common one, especially once you get your CPC, is becoming a medical coding specialist. So, medical coding specialists, like I told you before, they translate medical services into codes so that they can get billed and so that they are documented for statistical purposes. If you want to become a medical coder, some key qualities would be having a good eye for detail, having a good understanding of medical terminology, understanding your code sets, your code systems like your ICD-10 codes, your CPT codes, your HIPAA codes, and the such. Medical coders usually work in hospitals or clinics for insurance companies, but you can also work for yourself. You can also work for various other entities that has to do with, like, any medical reporting, lab work, things of that nature. Number 2, becoming a biller. A medical coder can be a biller, but unfortunately, a biller can't be a medical coder nowadays because a lot of jobs are requiring medical coders to be certified. Medical billers doesn't necessarily have to be certified yet. So, that's why a coder can really be a biller, but a biller can't necessarily be a coder. But there's always an exception to the rule. But medical billers are basically deeper into the financial side of the healthcare system. So they prepare and submit insurance claims. They communicate to the insurance companies, the encounters that each patient has. They also track payments and they handle denials. A medical biller has to have a strong attention to detail. They have to be very organized. They also have to have great communication skills and just kind of, be very, very aggressive and follow up. Medical billers can work in different varieties of, like, environments. You can work in hospitals, you can work in doctor's office, clinics, you can even freelance, similar to medical coders. So number 3, the third career path, most commonly taken by medical billers and coders, is becoming an instructor. So a lot of medical biller and coders, decide that once they've been in the career for a while, that they love helping other medical billers and medical coders understand and break into this industry. So it's definitely an exciting opportunity for anyone that has a heart for teaching. If you have a passion for it, you have a deep understanding of the coding principles and the billing policies, this probably would be the path that most commonly is taken by, medical coders and billers. Once you become an instructor, you can work in a variety of environments. You can work in schools, like vocational schools, like trade schools. You can also work in community colleges. You can also create your own online platform. This way, you are helping aspiring professional coders and professional billers gain the knowledge and the skill and a deeper understanding so that they can become successful in this field. This is definitely something that I aspire to do very soon. I'm working my way towards becoming an instructor. So I know for a fact that it's kind of like a natural progression that, a lot of us have. Um, Number 4. So a lot of medical coders, once they get into this field, they realize that their job takes on more of an auditing role as the years progress, as we get more advanced into this field. It's becoming more and more of an auditing type of situation. So a lot of us will go and obtain our auditing credential. So naturally, we progress into becoming a medical certified professional medical auditor. um Auditors like ensure that the coding is accurate. They ensure that compliance is being upheld, and they are making sure that all the regulations are understood and followed by all the parties involved: providers, coders, billers, and whatnot. Auditors conduct audits to validate, coding practices and standards, especially when, facilities, entities try to figure out workarounds that will help what their company do get reimbursed against certain insurance policies. And you will only understand that once you get into the field. Sometimes you have procedures and uh, medical diagnoses. You are doing some things that some insurances don't deem as medically necessary. The way that the facility or the doctor feels like they should be treating their patients. So it gets a little tricky. So you need auditors to maintain the integrity of, the communication between the providers and the insurance companies. Auditors um, provide valuable feedback to not only coders but to providers as well. Auditors play a pivotal role at improving the coding quality, preventing errors, recognizing possible increase in reimbursement opportunities. And this is essential for healthcare facilities and for insurance providers. Last but not least, medical billers and medical coders commonly decide they want to become a consultant. So, medical consultants are crucial in the healthcare industry. There are a lot of independent doctors. There are a lot of hospitals and healthcare organizations that's looking to improve their processes. And medical billing and coding consultants play a crucial role in helping them to do that. These experts can work independently or for consulting firms, advising healthcare organizations on coding and billing best practices. They help to optimize revenue cycles. They help to streamline processes. They help to ensure that compliance is being upheld, because this world is ever changing and regulations are very important. And so having a consultant on your team will help you to maintain the integrity of your healthcare system. Consultants often have years of experience in this field. And so in turn, they possess a deep understanding of the industry trends. They've seen a lot. They've seen a lot of changes, you know, especially valuable those that have been through ICD-9, going through ICD-10, those that have gone through different pandemic and epidemics, those that have seen the evolution of insurance companies, those have seen evolution of EHRs and EMRs and practice management systems. You can't pay for that knowledge. Like, to have that experience and to be able to have that understanding, from going from paper to electronic and the process that it took to get there. That's valuable information. That's valuable expertise, and consultants have that. And so if you are, you know, one that has been in this field for a long time, then you trying to like decide if you want to do something new, maybe consulting is where it's at for you. So I guess that's it. That's the 5 career choice paths that I have researched that most commonly medical billers and coders pursue once they obtain their credential. Again, those is, you know, of course, a medical coder, medical biller, becoming an instructor, becoming an auditor, and last but not least, going into consulting work. So there is a diverse of career paths that you can go through in medical billing and coding. These aren't the only ones, but these are the most common ones. Whether you prefer working hands-on with the codes, if you like managing finances, if you like teaching, if you like just auditing or being a consultant, there is a career path out here in this field for you. So hopefully you found this information helpful. If so, please give me a thumbs up. Go ahead and share this video with anyone that you think that might benefit from it, that's, you know, thinking about getting into this world or thinking about a career path, a career change for them. It may be very helpful for them. I want to thank you for watching today. Don't forget to subscribe. Don't forget to turn on your bell notifications so that you can be alerted to whenever I upload a new video. And just remember that the world of medical coding and billing is huge. There's so many opportunities out here. So don't hesitate to explore and find a career path that resonates with your skill set, with your personality, with your interests, something that you know is going to be with you for the long haul. Check out ahima.org. Their career map is awesome. You would definitely benefit from, you know, taking a look into that and seeing where it might take you. Until next time, I want to say thank you for watching, and I will see you in the next video.